Medical report, and of course, things are proceeding. I'm adding a lot of new conditions to our wellness conditions. So, and if you have been a customer in the last 6 months, you've bought one product, you have access to our live stream channel. We'll be starting to put up blogs regularly on the live stream channel. We're also reactivating Tim Alexander. He's getting help to get back up and putting his video blogs, not only his regular blog, but video blog up on live stream. And, of course, we're doing a lot of research with our scientists overseas. We have now, of course, the Bioplasm Pro and the Bioplasm Clinical, based on the Metapathia machine from the Soviet Union, Russia, from Dr. Nestorov and the agency that actually puts up the technology for the cosmonauts. I want people to understand the plasma physics of what Nutrimedical is. It's our most important nutraceutical. It has three areas that it does that are unlike any other molecular nutraceutical on the planet. It's, number one, it's the first and most powerful stimulus to make new mitochondria. Number two, it removes all halide toxins from the body, chloride, fluoride, and bromide, and decalcifies the pineal gland, which is the primary core to living waters that connects your physical mind, if you want to call it your brain, to your mind, which is equivalent to your soul. It does another thing. It actually not only mitochondriogenesis and removing these toxins, it kills all known pathogens. So if you're talking about things like Lyme disease, which causes MS, and can trigger off in the spinal cord, these pathogens can trigger off ALS. That's why when people are exposed to high amounts of formaldehyde, workers that are working around dead bodies, undertakers, etc., they're at much higher risk of getting ALS because it suppresses their immune system. The formaldehyde attaches to proteins of the brain in the tertiary motor neuron in the anterior horn cell of the spinal cord and increases the problem. When you take antipathogenics like Nutrimedical, you cleanse the body of not only extracellular but intracellular pathogens like Epstein-Barr virus, Incline Village, Nevada 6 virus, HTLV3, etc., AIDS virus, hepatitis B and C. There's nothing like it. So I tell people, you also are not just blocking radioiodine 131, you're actually resurrecting your mitochondria against Fukushima Daiichi, which is an extinction-level event. It is causing what's called radiological desertification of the North Pacific Ocean. And most people listen to the show, if they Google my name, they're going to say, oh my God, I don't want to talk to this guy. But if they actually listen to the show or communicate with me one-on-one, email or phone, they realize that I am, number one, a son of the Most High, I'm a believer. Number two, I have unusual talents that are given over to the Most High God. And when I don't have an answer, I pray. And one of those prayers years ago was answered with John and his Nutrimedical, which is an amazing molecule. So, John, this is Tesla-activated iodine. No one else has this. They'll try to claim they have it. They're marketing some product that sounds similar, and they're going to have a thyroid shield, whatever. All these other molecules, not only one are garbage, but they're also quite toxic. And then people need to understand, if you don't have the monatomic Tesla-activated form, you don't have these three remarkable properties, do you?
No, you do not, Dr. Bill. This is a very special type of iodine, and it works so well. We've proven it over again in field tests in Africa, in India, and we know it works. And it's something
how much
that
do you
no
think?
one else can say.
When people have, I'm going to go down through a list of conditions. When people have, say, middle ear problems, and they've got balance problems because maybe they have a middle ear infection with a chronic viral infection like a chronic subclinical viremia, or if they've got Alzheimer's disease or some other disorder, which is not only, it's a pathogen that upregulates the microglia, so you get free radicals. Those free radicals do three bad things. They lower your neurotransmitter levels, they interfere with mitochondria, because the cytokines generated by your microglia shut down your astrocytes from being able to create a neural network. So the first thing that people do when they take Nutrimedical is say, my brain woke up, my heart woke up, my heart failure is going away, my edema is going to my legs, and what are you doing? How come only this by itself? This is even before they take Cardiovasc and Vascucare and CoQ10 Ubiquinol, CoQ10 Supreme, and Uridine, and all the other fancy things for the mitochondria. Just taking Nutrimedical, they start saying, how many drops a day do you think I take of Nutrimedical, John? Just a wild guess.
Oh, probably 20 or more.
Probably close to 100.
Wow. And that's,
now people say, oh my gosh, that'll be toxic. No, other iodines would be toxic. This is energizing. I'm 63 and a half, and I'm healthy. I feel healthier and stronger than I did 3 years ago, 5 years ago, 1 year ago. The dosages that I'm taking now, my thyroid is, on my QRMA and my bioplasm, Pro, which I have right on my desk here. It's the fancy bioplasm. I just got by the way, the upgraded key. So if you have a bioplasm from us, you can obtain the upgraded key and software. Just contact me, and it's a fraction of the cost of a machine, and I will get that updated software to you with new functionality, etc. New functionality. We also have the bioplasm clinical with the hunter function. They can actually hunt and seek different illnesses and actually do a frequency therapy. And I've worked out a technology to actually do signal splitting so you can create a morphogenic therapy. So we're going to work on interfacing it with lumen photon, interfacing with pulse magnetic field, and sound therapy, so you can actually create a bioplasmatic therapeutic, if you want to call it morphogenic field around your body to heal it. The thing about Nutridyne is it has a scalar frequency, and of course, if you talk about somebody that's intuitive, they can actually see the chakra frequencies around people. If you do Kirlian photography, or if you do microcurrent analysis, like the, I still have a microcurrent device actually that does frequency analysis therapy. And what happens is that you look at the frequency for Nutridyne, it actually is the same as the chakra frequency for the brain. It's the highest frequency that the body has. It's really important because I tell people we're having a mitochondrial apocalypse between the pollutants that are killing the biosphere and people. The most important primary thing to resurrect and save the destruction of mitochondria, which is the energy source in the cells, is Nutridyne. There's nothing else to compare to it. I mean, with all the radiotoxins, all the halides, which chloride, fluoride, and bromide, all the other biotoxins like bisphenol A and other things that damage mitochondria, we wonder why we're getting people turn diabetic or dementia or autism. It's all related to primarily things like halide toxins and radiotoxins. And, of course, Nutridyne resurrects your body from any of these problems. It creates new healthy mitochondria, helps your body get rid of old ones. It helps to decalcify the pineal gland. It helps to do so many things. It's amazing, isn't it?
It certainly is. And, I just had it pointed out to me that a lot of the people who go on the vegetarian diets, and there's nothing wrong with eating lots of vegetables, but there's almost no iodine in those. So they need their Nutridyne to
isn't that interesting?
To fill in the body, yes, because people have gotten the idea that they can just switch off of meat sources, and I don't object to that, except that's where they were getting some of their iodine before. And
in the 1950s, they started iodized salt because they recognized some of the smart doctors, and of course, they also followed the U.S. Department of Agriculture because it turns out the USDA is usually about 30 to 50 years ahead of medical research. And they decided that they better add iodine and iodized salts as bread. But in the 1970s, these idiots decided to switch from iodine-based salts to bromine. Now, iodides can themselves in high dosages be toxic, but your body detoxifies and can convert a very tiny portion of it to the monatomic form in your thyroid gland and then export it along with T4 and T3 around your body, which then the body tissues deiodinate it and activate it when it needs to, because the half-life of T3 is 5.5 minutes. So if you had a concentration in your fat tissues or your muscles of T3, those molecules, half of them are gone in 5.5 minutes. The half-life of T4 is 14 to 16 hours. Okay, so it's a reserve form, and it's only 1/4000th as strong attached to the crystal gallium to turn on oxidative phosphorylation. The problem is that process of outer ring deiodination is dependent on monoatomic Tesla-activated iodine and 6 other minerals in order for that process to occur, which we have, of course. That's why we recommend selenium, cruciferate, and minerals plus, along with, of course, mitothyroid, which is better than Armour thyroid, Western thyroid research, which doesn't have the polymer as a cornstarch of titanium dioxide. You want Nutridyne. Everybody should be on Nutridyne. Dr. Penson on the air. And welcome back, and we've got Karen from Mountain Red Velvet. Now, we have 500 milligrams of Mountain Red Velvet, the highest quality ECM or extracellular matrix, and the tagline I use is if you're not a fetus, which we all are not fetuses, which means in Latin little one. That's why I get a kick out of the insanity of the planned unparenthood. Why don't they just change their title and people would realize that's what they are? But they're also insane. Crushing organs, pulling out livers, taking out limbs. I tell people, first off, when a fetus is genetically distinct from the mother, so it's not her body to remove, number one. And if women continue to push for abortion rights, they basically, what they'll find is in future generations, they'll just genetically engineer to have only an androgynous male. And you won't have females anymore. That'll happen here in North America. And you see it with the bizarreness of the so-called gay marriage thing. Now, I want to tie this back to our theory. If you're trying to regenerate and make a healthy baby, the mother should be taking Mountain Red Velvet, because it's going to help build stronger tissues, just like DHA or docosahexaenoic acid and Nutridyne. When you're trying to rebuild a solid organ, let's say you've got renal failure, and we're going to use things like extracellular signal therapy, like with micropulse and lumen photon, and hyperbaric oxygen. I call it the power of ones: oxygen, Nutrimed, SCALAR technology, and stem cells. And it falls under the ECM and Mountain Red Velvet fall in several of those categories. It's a Nutrimed. It is a scalar amplifier of signal-to-noise ratio, and it's a stem cell supporter. So it's literally in 3 of those 4 categories to help reverse aging and regenerate organs. What I do when I make my smoothie for my daughter with Down syndrome is I give her at least 1 or 2 capsules opened up and put in her smoothie every day. I take at least a couple capsules a couple times a day, and a lot of time I'm also taking additional ones I have right on my desk. That I will literally open the capsule, put it on my tongue, because I can speak with 1 capsule under my tongue, and you won't detect it, but I can't do it with 2. 2 is a little too much, because I have to hold it there for 10 or 15 minutes to absorb it through the buccal mucosa. When you start doing this, what you notice is that it feels like they put you up on the hoist and they did a lube job in your joints. Your joints don't ache. You will find that your skin starts to become much more healthy. You'll notice that your hair is healthier. You'll notice that you go back to your dentist and say, gee, your gums are regenerating. What you'll notice is your capacity to heal is like you're a young person again. Pretty neat. And I tell people, no matter what your illness is, a lot of the quote process we call aging is really just a lack of directed healing and regenerating yourself, or literally photocopying your body into the future. And when you start doing take Mountain Red Velvet, you've got what I got, the best possible toner on the planet. How's that?
Exactly.
So Karen, you got certification in Australia, which is very, very hard to get, and it's the toughest market on the planet. Now, things are much more logical in Aussie land. In Australia, once you get high-level certification, it's we call pharmaceutical-grade nutraceutical, and it has benefit to heal and treat. The doctors actually prescribe it.
That's right.
Just like they do in Great Britain with Alamax, Alamed, etc., and Australia and New Zealand. Their attitude is, if we can prove a physical, physical benefit to the body, and we can get a pharmaceutical-grade consistent molecule that can be proven in research, the doctors can prescribe it, not like in knucklehead land here in America or Canada or other Western countries where the pharmaceutical industry kind of rules and doctors are considered medical misfits and heretics if they start pushing nutraceuticals. So I'm real proud of the Aussies doing this and the Kiwis, the New Zealanders, because what it means is they're realizing that their role is to assist the body to heal itself. Exactly. So, Karen, a lot of people are going to avoid knee surgery and knee replacements. A lot of them are going to regenerate their lung tissue if they got bronchiectasis. A lot of them are going to remyelinate nerve fiber tracts in their brain, so they're going to reduce dysmyelination, dementia. A lot of them are going to notice their skin's not going to be like tissue paper, and they bump into a door jamb, their skin won't tear when they're 75 or 80 years of age. A lot of them are going to notice their nails are going to be great, and their hair is going to be lustrous and not snap off. They're going to notice that they look good.
Exactly.
You probably have a lot of, I call positive complaints from people that take your product. Can you give us some of those positive complaints?
Especially the older people say, oh, gee, I'm not creaky anymore. I'm back out doing. I can play a game of golf. I can go around the supermarket and push my trolley. I'm sleeping at night. We have our athletes who all race to give us testimonials about how much more they can bench press or how much more they can leg push. And what they find is they can train harder for longer, but they recover quicker. And they don't have those micro injuries, which is huge if your body is your job in terms of a professional athlete. But
well, yeah, that's the micro injury is what ruins older athletes. If you take an older athlete, look, they got more experience, they got more strategy, they're smarter. The only thing they have to do is maintain reflex speed and not get micro injuries that become macro injuries where you tear a rotator cuff or an ACL or your cartilage grinds down your knees or you get a prepatellar bursitis or whatever. And if you can maintain tissue tensile strength in your joints and your hydroviscous layer in your joints and your muscle strength and your reflexes and proprioception, guess what? You're going to still clean the young guys and girls if you're an athlete in your athletic performance, because you're not going to have those micro injuries going to sideline you. And that's what we're seeing, is that older and older athletes are actually still shining well beyond what you expect in a normal career if they take Mountain Red Velvet.
Yes. And it's not only the professional athletes, because we have lots of mums and dads who are really
weekend
busy.
Warriors.
Yeah, exactly.
Where they decide, I'm going to do a whole lot of stuff on the weekend, but during the week I'm not walking more than half a mile.
Yeah.
and they go out and they try to do 18 holes of golf, or they go kayaking or something, and then they wonder why. Well, if you take Mountain Red Velvet, you're not going to wreck yourself, but if you are not taking things to support healing, those injuries start to accumulate, and your body says, now I'm really going to hurt you. You're not going to sleep for days after that weekend warrior stuff you're doing.
Exactly. And so, it crosses so many boundaries in terms of the people who it works for. And what I would say is there's no other product out there on the market that contains 396 different active ingredients, right from your teeny tiny amino acids to it's packed with collagen, your growth factors. There is no other product like this that you could take for good health. One capsule.
Yeah. 396 biomolecules, 6 growth hormones,
absolutely.
and I looked at the number of classes of the molecules there. These are weird and wonderful. I venture to say we probably understand less than 10% of what these weird molecules do to actually regenerate tissues. I classify them into 3 or 4 categories. First is building biomolecules, molecules necessary like the director set to build your cells and tissues. Number 2, enzymatic cofactors to make enzymes work, which, by the way, if they're not there, the enzymes don't work. Number 3, scalar transducers. These actually fit in your cell membranes and make your signal-to-noise ratio to turn on your genes. And then number 4 is these are what we call regulatory molecules that actually are hormones that regulate the actual process of growth, hormone stimulation, tissue regeneration, etc., and they redirect stem cells. So we're looking at amazing effects that people get Mountain Red Velvet. I tell people, if you're an athlete, if you're a young person, you don't want to get old, start the repair process. Start the schedule today of taking Mountain Red Velvet, and you'll slow the aging process dramatically. We are here heading towards zero senescence. Mountain Red Velvet is a major step on that pathway. Get it today and age less tomorrow. Welcome back, Dr. Bob.
Hello, Dr. Bill. How are you?
Very good. Always thinking. I dream in equations.
Really? Yeah, I can appreciate that. I think I dream in 4 dimensions. I'm constantly designing.
Yeah, exactly. Yeah, what I call or equations or theorems or whatever. People that don't realize that people that are creative literally dream and sleep and breathe on a qualitative level that's different than the average person that just goes about their life. And I have lots of dreams about what you're doing with the micropulse and how we can marry it to other technologies. For example, and this is just using my imagination, I'd like to see a future version of the micropulse that would have an interface with our bioplasm clinical with the Hunter function based on the metapathy from Russia that could allow you to create a morphogenic field, not just on the topical area, which we have now, which is amazing healing. But I create literally a morphogenic field that you could be in hyperbaric oxygen chamber with ozone and maybe trace gases like hydrogen sulfide and helium to increase tissue penetration and activate enzymes. But it would actually, a person would go in there for, say, an hour a day, and in severe situations in a hospital, you'd actually create what's called a suspended animation regeneration chambers, where you put people into an artificial coma over the next few days. You'd surgically repair lesions. You keep their body cooled while you gradually warmed it and regenerated the tissues and get their own stem cells activated. And the therapy field that you create with a future, we call clinical hospital version of the micropulse, would create not just a local micropulse field, but around the entire body. So the work you're doing is pretty important. And I also see, for example, people are short of organs. Let's say someone's waiting for a kidney transplant. I can see in the future they will do things like, let's say, take a pig kidney, decellularize it, recellularize it with a person's own stem cells, create we call a gene, if you want to call bioengine, to use your micropulse drivers to actually increase the signal-to-noise ratio, put a surgical version of our Mountain Red Velvet ECM intravenously into the tissues so that they can perfuse them, and over the next 3 to 6 months, grow someone a kidney. And then transplant the kidney in, which is their own cells and tissues, so there's no rejection, no anti-rejection drugs. This is a technology which I see coming, and your research on the micropulse, which is now available under $400, is available right now. People don't need to go for a knee replacement. They don't need to worry about a chronic Achilles tendonitis or a patellar tendonitis. They don't need to worry about, they can put it over their liver if they've got hepatitis and they're trying to kill off the pathogens and regenerate it. They can put it over their heart if they're trying to reverse congestive heart failure because they're diabetic and they have hypertension. They can put it on with a little headband around the temples if they've got pre-dementia or Parkinson's disease or some other basal nuclei problem like extrapyramidal syndrome. So, I mean, the uses are, to me, of the micropulse are endless, aren't they?
Well, I think there are many of them, and in fact, it's interesting to talk about the effects of putting the right field, the right signals around organisms and organs and tissues when they're in a sort of a disuse, like as you said, like a coma, a sort of a comatose, suspended animation state, and that's really the same kind of problem they run into in space travel.
Right.
And it turns out that they, that's an area of very active research. And in fact, I'm developing collaborations now to see the extent to which we can prevent loss of, bone density, loss of structural tissue mass, even with prolonged periods of zero gravity and disuse, because, the micropulse ISIS waveform has been optimized over the years for simulating normal loading in musculoskeletal structural tissues. So there's every reason to believe that it would be very helpful for that.
Right. So, for example, let's say you have a DEXA bone scan, and an 84-year-old female is at risk. Her family lives to be 100, but you don't want the last 15 years to be in a striker bed in a nursing facility with her clues still around. She can read, watch television, but she can't go out and walk because her T4, her mid-thoracic spine is kyphotic and her lumbar spine is so osteoporotic if she stands she'll break her spine and get a paralysis. And of course you can surgically blow up that vertebral body, but it doesn't mean that you're not going to get a cauda equina syndrome. So you got a person who's really disabled and they're at risk of bed sores and then infection from that. You take somebody like that, and I've done it for now 25 years using just the old style pulse magnetic fields, but the micropulse is lower energy but much more elegant, the right frequency at the right pulsatile range to actually stimulate healing and turning off pain. I put them on Bone Generator, MyCell D3, Myco D2, Full Vitamin K2, Collagen Max, Mountain Red Velvet, Joint Performance Tendon Mender, and then I tell them, slap on the micropulse, move it around to all the problem areas. If your L4 vertebrae is bad and your right surgical neck or your hip on the DEXA bone scan, repeat those tests in 6 months and repeat in as little as a month your levels of deoxypyridinium and pyridinylene subunits of collagen at directlabs.com through Genova Metametrics Lab, and guess what? You'll stop dropping the collagen microunits from your connective tissues into your urine, and if you repeat your DEXA scan in 6 months to a year, you'll say, my gosh, Dr. Deagle was right. I took the micropulse, slapped it over the weak areas of bone, and lo and behold, my mom's not going to end up in a nursing unit on a striker bed. And that's how amazing it is. And so people say, you're kidding. No, I'm not kidding. You see, the problem is we're reinventing what medicine is. We're doing I call functional living pathology. When I went into medicine, my professors, because I had an equivalent PhD before I went into medicine, kept on saying, Deagle, you're too smart for this. You need to go into pathology. Pathology, I said, but all my patients will be dead. He said, you'll be 50 to 100 years ahead of your colleagues, right? But they're not going to integrate it into practice. And then what's happened over the last 45 years, and I've been a major part of that, through the American College of Environmental Medicine, Advancement of Medicine, Anti-Aging Medicine, and I'm preparing my lecture this December. It'll be probably the lecture will be finished this weekend, to prepare my theory, which is going to blow all the other theories about what aging is and what disease is, using what I call the plasma physics of entraining tissues and signal-to-noise ratio, etc. And what people should understand is when we do this, in the next 5 to 20 years, we will destroy the whole idea of what aging is. Aging is going to die. It's a disease that kills 90% of people die of aging, whether it's heart failure, cancer, autoimmune diseases, or chronic infections. Aging is a primary killer of people, except people that die of what I call stupidity, driving too fast or drinking too much or jumping out of the tower with a bat suit on, flying, around skyscrapers. Okay, so that's what's neat about this, is that we're actually approaching the point where aging isn't necessary in the future. And, I see ambulances that'll be mild hyperbaric. They'll slap a helmet to cool off your brain. They'll give you a shot by transdermally through your skin to turn off the free radical reactions so they can transport you while your brain's being cooled before you get to the hospital. So if you go full cardiac arrest or you're bleeding out from a dramatic bleed, you won't die, because we stop the free radicals and we suspend your tissues so you don't get 4 golden minutes. You maybe get 40 or 80 golden minutes. And I see this technology as part of that. Part of the helmet might be you create a micropulse helmet that cools their brain off at the same time. Why not?
Well, it's absolutely clear that kind of technology works. And in fact, here in North Carolina, I was on the first paramedic team, because I was actually a fire chief, volunteer fire chief here just outside Durham, that applied cryotherapy to a person with a severe heart attack.
Right.
And I was the first person on the scene, and we checked him out, and he was a candidate. We applied the cryotherapy to him. We packed him in ice, basically. It was very crude.
Right.
This was probably 6 years ago. We packed him in ice.
But it worked.
And, he went into the hospital as a really severe MI. He walked out, no wheelchair, that evening.
Right.
Just simply cooling him down promptly made all the difference in the world. And you add up all of these little advances that we have scientifically, whether it's, the right signals, the right substance, the right sort of cryotherapy at the right time. And, we're adding every year now, we're adding 3 months onto the human lifespan. Every year that you live, you can expect to live another 3 months. It's amazing.
Save $30, use code drdeagle, go to our link at Associates, and get a micropulse today. Get 2 of them. One for yourself and one to loan to all your friends and family. Get it today. Save and heal and age less. I get all kinds of challenges. I love challenges. I was a puzzle master. I remember before I did my first serious IQ test in grade 9, and I remember Mr. Bromwell, who was the school teacher that was actually doing all the testing. And he says, "Man, you're really good at puzzles, Deagle." And I said, "What do you mean?" He says, "You have the highest IQ of anybody in Halifax, Dartmouth." I said, "You're kidding." I said, "Well, I like to do puzzles." And I tell you what, the reason is I tell people I can train anybody. I don't care if you got Down syndrome, you previously got D grades. I can make you think better about how to think. And what I tell people is you've got to start, how can I say it, you've got to start thinking out of the box. And one of the things we're talking about with Ron is the idea, this machine is pretty amazing. I have it parked here right beside me, and I get all kinds of challenges. And I have a really excellent dentist. His name is Dr. Jeffrey Curbs. But I want to introduce him to other technologies. For example, one of the big problems he deals with regularly is dead bone. Now, if you've got NECA, which is, of course, dead bone or osteomyelitic bone, and you therefore don't have microcirculation, you usually have pus in there like Staph aureus or some other garbage growing. You get nanobacteria, which is the formation of plaque. If you want to regenerate that tissue, firstly, you surgically drain it. And what I often recommend is they use what's called YAG laser and deep ozone therapy, but it can only get the surface. I recommend people start using Nutriiodine, Allicin Med, and Silver 100 and boost their natural killer cells with our Nutri-Defense and immunoglobulins, Nutri-Immune or Ageless. But the most important thing, believe it or not, in terms of signal, is to entrain those tissues to start regenerating and healing. And it turns out you already have research on what's called NECA. And tell us a little bit about the research on this, because I want people to understand that you can actually reverse periodontal disease pretty nicely just by using lumen photon and, of course, the right nutraceuticals, too. So what about this NECA research? What happened? Because a lot of, the first thing is a lot of dentists don't realize typical antibiotics can't get through the biofilm. So they're relatively useless. So even when they remove, for example, let's say they remove impacted wisdom teeth, they'll often leave it open even if they have to crack and break a tooth off, and there's a risk there for what's called a dry socket or infection in the bone. If they take our nutraceuticals, but the signal is use lumen. So rather than rushing in and doing bone grafting and all the other garbage, take our nutraceuticals, kill off the pathogens, stimulate the bones with Collagen Max, Bone Generator, Micelle D3, Myco D2, Full Vitamin K2, etc., use lumen. And what settings do you use for reversal of NICA?
Well, that's what we call the NICO setting. And really, that is the one that we use on that because we're trying to get more circulation in there all the time, which brings the oxygen back into the site. And the
antipathogenics, too. It also brings in the Nutridyne, the Silver 100, the Allison Med into the tissues to perfuse the bone to get rid of the infection.
Yeah.
It also brings the stem cells in, so you reattach the sharp A fibers to the tooth root. You reestablish circulation to the pulp space of the tooth. You reestablish the bone that actually starts to grow back. Because remember, interesting thing about membranous bone, it doesn't get less dense, it retracts away from the tooth. So if you do an x-ray, like a pan x-ray, this is for you dentists out there, if you start using the NICO setting of the lumen, along with our nutraceuticals, you'll actually see the bone start to encroach back on the tooth, and then with your Collagen Max, Mountain Red Velvet, etc., you'll actually see the sharp A fibers reattach to the tooth, so it becomes solidly embedded back in bone matrix. And I tell people this is the same thing we apply for whether it's osteoporosis of the bone, and I can often use both technologies, the micropulse and the lumen, because they're both very portable and simple. It doesn't matter if you got migraine headaches, you've got retinal problems. I have a gentleman who just consulted us who has diabetic retinopathy. Part of his retinopathy protocol is he's going to have a lumen machine and put it either, if not over his eyes, he can actually put it at the side of his head, because it'll penetrate through 12 inches of bone, muscle, ligament, brain, whatever. So you don't have to actually stare at it. You can put it at the side of your head, and it'll go through the side of your head, right through your eyeballs, and it'll help regenerate the retina, reduce the intraocular pressures, which is the canals of Schlemm at the limbus of the iris of your eye. And we take our antipathogenics, you take our things to regenerate the tissues, and the lumen does three things. It'll improve circulation, brings in stem cells, cuts free radicals, and stimulates the extracellular matrix to make new tissue. And you can use that with the micropulse, so you get an amplified effect. So people say, I want to regenerate my liver. I said, get a lumen machine and get a micropulse. Take all our nutraceuticals, because you have to have the substance to work with, and it'll regenerate. People say, you're kidding.
The liver can really jump to this. It really does really well recovering and regenerating itself.
Yeah, I tell people, over somebody who has congestive heart failure, somebody has a damaged liver, somebody has inflammatory bowel problems, take our nutraceuticals to get your inflammatory bowel under control, and you want to regenerate the basement membrane of the bowel and the villi and the normal enzyme act at the ends of the villi of your bowel wall. Your lumen photon is going to amplify the extent and the speed of healing. That's what's neat. So it doesn't matter if it's putting your feet on it because you got peripheral diabetic or toxic neuropathy, or you're trying to regenerate a ligament because you've just had a recent ACL repair from a transfer of ligaments from, say, your Achilles, or you're trying to repair a damaged joint and you're now taking our nutraceuticals to restore the hydroviscous layer in your joint, or you're trying to heal post-surgically. Every post-operative surgical room, whether it's a plastic surgery, general surgery, orthopedics, should be stacked in their post-op room with lumen machines, shouldn't they? Every single one. They'd be, instead of using narcotics.
We think so, yes.
Instead of using narcotics, they should say, hey, what are the red lights for? People would be saying, of course, if you want to tell them before they go in their operation, oh, I want my red lights. And they just turn the red lights on, and you just keep turning on the button, and people say, they press the button, the nurse come in, turn them on for another half hour or so. And guess what? They wouldn't need narcotics. They'd walk out of the surgical suites rather than being wheeled out, kind of spaced out of their mind on narcotics.
Yeah. It's really that simple.
It's that simple. And the thing is, if it works for veterinaries, if it works for animals don't lie. I mean, one of the things about dogs, for example, and cats and
that was
birds.
Like when we started out with this, and we were the first testing. That was before I actually got involved. Dan Paris, the guy who patents all this, had a horse in a racetrack, and they called him in to see if they could try to repair a broken leg on the horse's leg, and.
Right.
He started using the lights, did this, and within 2 weeks the horse was running again.
Right.
And that blew everybody out the walls.
When I have my lecture finished, and again, I think the final form, or close to, because I'm a finicky character trying to put as much in here and compress it into a new... See, I want to have a framework for what aging is and what regeneration, what tissue is, because to be honest with you, the current medical profession are not scientific. I went into science realizing I had a particular talent at science and being able to see things and But it pisses people off, to be honest with you, because when you show that their thought patterns and their logic doesn't hold up, and their whole approach to what a disease is, for example, what is NICA, what is heart failure, what is degenerational liver disease, what is a mitochondriopathy, they don't realize their whole a priori assumptions were incorrect in the first place. And one of the things you find interesting, people are real smart, people with Down syndrome have one thing in common. They can't deal with cognitive dissonance. I can't. If I think something doesn't fit, my brain will just go on and on like a machine, trying to find the answer to it and pulling things apart in little tiny micro, what I call, components of the concept until it finally figures it out. And I think Lumen is really cool. So what we're doing is we're talking to Ron about the idea of having a signal input. So if you get a Bioplasm Clinical or Bioplasm Pro, you can plug in your Lumen and it'll actually provide a treatment frequencies feedback morphogenic field. In other words, it can actually be tuned to a specific frequency. That's going to be cool.
Okay, that sounds like something we really want to work on and get this right.
And all basically is an audio input, so we can actually have a frequency adjustment.
Yeah.
And we have a little amplifier that'll run off the Bioplasm Clinical or Bioplasm Pro, and you could actually do, while you have the hydrophones on your head and you're doing what's called the neural frequency cycling, you can actually tune it to the body tissue. So let's say, and it has a thing called Vegeto test, so it can actually tell you what supplements are going to be percentage of healing of the tissues. So it does what's called a spectral frequency matching. So we can actually adjust the spectral frequency to actually know we've tuned directly into that tissue to heal it. Is that cool or what? And you can actually see it on the screen live as you're tuning it. That's what's even cooler.
Yeah. Oh, yeah. And this is what you're doing at 2 o'clock in the morning?
I do it all day and night. When I wake up in the morning, I have usually worked out. I have whiteboards and I have everything in my mind that already have all kinds of stuff.
Yeah. Yeah, that's exactly.
As I say, I'm an oddball, but God has to sprinkle society with oddballs like me to find solutions to complex and weird problems. And to me, I get so excited about Lumen Photon. As I say, if you don't have one for yourself, and I tell people get at least a couple, because when they're going to want to grab your machine, and you're not going to you want to keep it for you and your pets. My dog's real healthy, but if he had a bung hip, he'd be laying on my Lumen machine for hours a day, and he'd be happy boy. I'd have a hard time getting that Lumen back from him, I'm sure.
Yeah.
It's neat. If budgie birds and fish and dogs and cats and horses respond, how about you? Get a Lumen machine today and heal tomorrow. It's amazing. Thank you, Ron. We will be hour 3 with Ann Morrison in a moment with our science blog. Stay